Imagine experiencing a painful toothache and not being able to verbalize it. Imagine the pain lasting for 5 minutes. Now imagine 5 hours, or 5 months or even longer. This is a very real scenario for patients with intellectual and developmental disabilities, or also known as IDD. In fact, access to oral health care is the #1 unmet healthcare need for individuals with IDD. TouroCAREs hopes to change that for patients in the Lower Hudson Valley and beyond. But don't take my word for it. Hear from the patients and their families who currently are being treated at Touro Dental Health.
3, 2, 1.
Liam is a 10-year-old boy. He has autism, ADHD, and a tic disorder. He loves dinosaurs, Roblox, and animals. Dental care for Liam has always been a challenge. When he was younger, about 5 years old, he had 2 very big cavities in his teeth, and we went to the dentist. We couldn't even get him out of the waiting room. When I called to make an appointment to go into general anesthesia, they told me they were booking out a year to 18 months, which is heartbreaking when you have a 5-year-old little boy in excruciating pain to wait almost a year to receive dental care. Whereas if it was, you or me who's neurotypical can go right to the dentist and get that fixed. Working at my job, I heard of Touro. We went down there and we met with the team. Dr. Roz was there. She said, we don't do general anesthesia. We can try with nitrous. And I said, oh, okay. So we can try, I would like to avoid general anesthesia. And they listened to everything I said, any supports for Liam that I needed. They were very understanding. And he got the tooth extracted and I cried like a baby because I really thought he was going to need general anesthesia for the rest of his life. And I did think maybe there was, a 1% chance we were going to get it done. It was a huge relief. There is hope. And Touro gave me that hope.
My name is Gedalia Goldman. I am 16 years old. I am autistic and legally blind. I also have ADHD. And I am very into math, music, and religion. When it comes to these special needs kids, like myself, some of us, we have a very hard time at the dentist. The dentists at Touro, they seem to have infinite patience, and they are very compassionate. They definitely seem to understand what people like me are dealing with.
My daughter Irina, she is 34 years old. She is cerebral palsy. She is developmental delay, and she has epilepsy. In 2018, she had an accident and she lost 2 front teeth. I went to her regular dentist. He told me they don't do implants in this kind of population. And I was so upset. And I told him, what happened if this happened to your daughter? You don't do nothing? You leave it like that? And he didn't know what to say to me. I went to look for another solution and start my journey. I went to different places. One place I waited 1 year in the waiting list to finally tell me, no, we don't do implant. When I went to Touro, we were received with happiness. Dr. Alex, he started with the evaluation. He was so enthusiastic. Right away, they integrate me in the team. They approved for implants. Her new teeth, they are fantastic. Every time I say, Irina, show your smile, she's showing to everybody the teeth. My daughter deserves the same kind of care that myself and you and your neighbor deserve.
They are just like you and me. They're human beings. They deserve the care that we receive. Just because they think a little differently, they act a little differently, they need a little bit more supports, doesn't mean they don't deserve the dental care.
Just think about it. 3.9 million New Yorkers, do not have access to dental care because they have disabilities. It must be horrible for them. So we need a new clinic and more dentists that have the resources to treat such patients.
Patients with IDD deserve this. They deserve a place where their dental needs align with their social and intellectual needs. They deserve TouroCAREs, the Center for Access, Respect, and Empathy. Please join us as we build TouroCAREs so that no one suffers because they cannot find accessible oral health care.